I've treated over 100 hip replacements in 2025. This is everything you need to know about hip surgery. I'm Matt Sigua. I'm a doctor of physical therapy, and these are some of the common questions I get asked about hip replacements. Are they successful? Yes. So, for all the patients that I've seen, they all stated that compared to the pain that they had prior to the surgery, the months or even like the years of hip pain from the osteoarthritis that they've had, the pain after the post-op discomfort that they initially had was much better, if not completely gone after the hip replacement. Now, just because once you have the surgery, and that pain is, you're having that major change in terms of pain relief, the function is still going to be something that needs to be worked on. But overall, if you're comparing or dictating the success of a surgery based on that pain relief, then all patients that I saw in 2025 had a major difference in terms of pain relief. So it was much better. What symptoms should you expect after surgery? So after surgery, since you're going under and have some of the anesthesia, some patients will experience some nausea, vomiting, dizziness. Not every patient though, but that's just one thing to be expected whenever you're having a procedure where you have to go under anesthesia. The typical swelling, edema, some bruising to that operative area. So right at that hip, whether you're doing an anterior hip replacement or posterior, you should expect a fair amount of edema, swelling, and some of that bruising. What equipment do you need after getting a hip replacement? Equipment-wise, typically once you get discharged from the hospital, they'll usually send you home with like a front wheel walker. So you'll have an assisted device to get you around from the hospital to the car to use for when you're at home. So initially, timeline is something we'll get into a little bit later, but a walker is something that's typically given to you. If you weren't given a walker, then that is something that you would want to get yourself, because then you're going to be pretty limited in terms of your function. Whenever you're walking around inside the home or trying to transfer from like the bed to standing or even from like the couch to standing. One other thing that patients will commonly buy is a lifting strap. So after the hip replacement, lifting your leg up and using that to swing over the bed or trying to move the leg around a little bit more freely. It's going to be a bit of a challenge. Not only is it going to be a little bit uncomfortable, but you're just not going to have that strength that you need to lift up the leg. So having a lifting strap where you kind of throw it over like your foot and you use that strap to help you move over the leg, just to give it a little bit more assistance. So a lifting strap is something that some patients used, but it wasn't 100% necessary because timeline-wise, you may be using that strap for less than a week, maybe even just a couple days. Sometimes hospitals will send you home with different types of ice, but if not, you will for sure need some kind of ice pack. Ideally, having at least two, because you're going to be trying to bring down that inflammation and that swelling at the hip pretty regularly throughout your day after the surgery. So that first week post-op, even up until 4 weeks post-op, you're icing that hip pretty regularly. So having two is nice because as soon as you have one of those ice packs on for about 15 to 20 minutes, that temperature is going to warm up the ice pack and it's not going to be as effective. So then you can throw that first ice pack into the freezer, pull out that second one, so you're not going too long of a period without icing, because then the amount of swelling, since it's going to be pretty significant, you want to bring that down as much as possible to help reduce that inflammation. So 2 ice packs is definitely recommended, but if you only have one, then that'll do. When do you start physical therapy? Ideally, you're starting physical therapy the day after you leave the hospital, so day 1 post-op, because once you have that surgery, physical therapy, and most of the times they're getting you up in the hospital that same day. They're getting you on your feet. So kind of expect that and be ready the day of surgery. Most of the time you're standing on your feet with the walker, with that assisted device. Now, every surgeon is going to be slightly different, but from my experience, in this past year, typically the weight bearing precaution is weight bearing as tolerated. So essentially, what that means is you're safe. That joint, that hip joint, is actually safe to bear as much as your weight as you can tolerate. So that doesn't mean that you want to stand, on one leg, single leg stance on that side that you had surgery um, right away, because then that's just going to cause maybe a little bit more inflammation, a little bit more pain, which is not necessary, obviously. But in terms of the integrity of the joint, what they did with the replacement, the arthroplasty for the hip, it's structurally sound and it can hold your body weight. So for you, once you're if that's the precaution your surgeon's giving you, that next day you want to be up on your feet, you want to be moving, you want to be walking a little bit, and then that progresses as a little bit more time goes by. Every day, every other day, your walking distance increases a little bit more using your assisted device or your walker. So your physical therapy, ideally you're starting the day after you have the surgery. Now, another question I ask is physical therapy necessary? Yes. So after that, you have that hip replacement, that total hip replacement, you're going to have a nice relief in terms of pain, especially as you get, 1 week post-op. That initial post-op pain, that acute pain that you have is going to be decreased a fair amount. And then you're going to kind of start to feel the difference between that type of pain that you had prior to the surgery compared to the pain that you're currently having. It's going to be much better. However, what you'll find is the function, so the strength, and then your overall functional mobility. So getting in and out of bed, getting in and out the sofa, getting on and off the toilet seat, those things are going to be much more of a challenge. Now, obviously, the better you go into surgery, the better your outcome or your ability to move is going to be. So that's why the ones who do their homework prior to getting the surgery have a much better prognosis and outcome. So PT prior is definitely a plus, but in terms of PT right after the surgery, that's one of those things that you don't want to ignore, because if your goal is to, everyone's goal is going to be slightly different, but really there is no reason that you can't return to certain physical activities, whether that be, some type of sport or hobby that is just a little bit more physically demanding than your regular everyday activities or your activities of daily living. So your prognosis in terms of how well you can recover to do some of those more higher level or higher advanced activities, it all depends on how soon you start physical therapy and how long you continue that. Okay, so yes, I obviously come from me, think physical therapy is necessary. What is the timeline for recovery? So I'm just going to be speaking about that 1 month timeline in terms of what you should expect, because then, as you get past that 1 month, things, everybody is slightly different and everyone's goals are different, but you'll have a much clearer picture in terms of that first month. And this is really a crucial time in terms of the recovery when you're implementing physical therapy in terms of after the hip replacement. So day one post-op, the following day after the surgery, you're up on your feet, you're using the walker, you should be starting, your physical therapy. Now, what that looks like in terms of your symptoms and your mobility. So typically, that first 1 to 2 days, you might be dealing with a little bit of nausea, vomiting. So some of the side effects of the anesthesia from going under. Now, typically that goes away if you do have that, like 1 to 2, maybe 3 days. But in terms of your mobility, you still want to be, ideally walking once every couple hours. And that doesn't mean you're walking far. Essentially, you're going from one room to the next. So you're going from your bed to the bathroom or your bed to the kitchen, that type of thing. So it's not long distance walking. It's more of you're trying to do frequent walks throughout your day, because that's going to help a lot with the circulation and the edema. Because then as you're icing throughout your day, as you're kind of just resting, recovering, because you're going to want to be lying down a lot, what you're going to have is, because you're going to have that lack of movement that you're typically doing on your everyday, you're going to get some joint stiffness, whether that be primarily at the hip or even at the knees or ankles. But you're also going to get that accumulation of those fluids, so the swelling around the hip. If you're not moving your body, getting circulation going, getting the lymphatic system going. So for you, the more you can change position in terms of from lying down to sitting, sitting to standing and walking, that's going to help kind of move that fluid along, so then it's not accumulating all in that one area of your hip. Okay. So that first 1 to 2 days, your main goal is really just trying to walk around a little bit. You're not doing any of the more complicated exercises just yet. So now that you get to essentially like 1 week post-op, your physical therapist will specifically give you the exercise that they want you to work on at each day. But once you get to 7 days post-op, now 7 to 10 days, you're talking about removing the initial dressing or that initial bandage, the big outer bandage above the incision. So typically your physical therapist is going to help you with that dressing removal. At that point, you're going to notice you're walking in terms of how easy it is to walk, how easy it is to get in and out the bed. So some of those functional transfers, so getting in and out the bed, on and off the toilet, those are going to be a little bit easier once you get to 7 days. Because obviously by this time you're doing some of the exercises. Some people at 1 week may discontinue using the initial walker that they started with, and they're switching over to maybe like a quad cane or a single point cane. Not everyone, but some people do. But your walking by this time should be much better. It may not be like the normal gait pattern where you're walking how you were prior to surgery or before you you started having the hip pain, but much better in terms of your overall confidence in your balance, your actual stability as you're walking should be better, where you're not relying so much with your upper body to use the walker for stability and balance. Now, at that 4 to 6 week mark, so essentially once you hit to 1 month post-op, most individuals that I've treated, they were advanced from the walker to the cane, and actually a fair amount of them went from the walker to no assist device by the time that they hit that 1 month mark. But everyone's recovery is going to be slightly different in terms of timeline, but typically around that 1 month mark, there is a massive improvement in terms of how much they're relying on that walker to now they're not needing an assisted device at all, or they're using a cane, or in the very few circumstances, they're still using the walker, but their confidence is much better, and they're only using it just for a little bit of balance, but not so much to really support them in terms of like weight-bearing purposes to get pressure off of the hip. So overall, in terms of the prognosis after a hip replacement, all the individuals that I worked with this past year, they all had much better outcomes in terms of subjective pain scales, saying essentially that the pain that they had after the procedure was significantly better than the pain that they had going into the surgery. So for those of you who are trying to have or are scheduled to have a hip replacement in 2026, the outcomes and prognosis are very good in terms of, that pain relief that most people are primarily going into the hip replacement for. And then for the ones who had higher level of goals in terms of they wanted to get back to hiking or jogging or some kind of sporting or physical activity, the ones who had those goals in mind, they were able to reach those milestones with continued physical therapy, meaning 2-3 months or 3 months plus of physical therapy to really get that hip and also the muscles of the rest of the lower extremity on both sides stronger, so that they can safely return to those activities. Overall, hip replacements in 2025 going into 2026 are a pretty reliable surgery, pretty reliable intervention that it's definitely much easier to recover from and regain a lot of strength, improve pain compared to before. So if you have any questions or any comments about hip replacements, please feel free to leave them down below, and subscribe if you If you learned anything beneficial from this video, thank you, and I'll see you on the next one.